I don't know if a lot of people know, but I won your guys' giveaway for my lip injection. So that video that we posted about this, that's me and Dr. Sandy getting my lip injections done. I love them. I love them so much. So I'm really excited. And I think it's so awesome that we don't have to travel, hours away to get really awesome treatment here in Riverton. I think that's awesome. When I told people I got them done here, they're like, where did you go? I'm like, no, I got them in Riverton. And they're like, oh my gosh, they look so good. So people are really happy to have this here. Yes. That kind of is a good segue into what our next topic is, fillers. So for some of those ages that maybe aren't right for Botox, would filler be a better option? Or is that a better, if you already have deep wrinkles, should you be looking at filler instead of Botox?
That's a great question. So, and that's something that people often ask. Your Botox is going to soften wrinkles. They don't fill in anything. So as we age, you lose the elasticity in your skin. Oftentimes you'll lose the blood vessels that are in that area tend to diminish, or maybe they don't supply as much to that area. You lose collagen. And so then you get the hollowing around the mouth. You'll get the face kind of just moves forward. Basically, you get the jowls down here. So filler is just that. It's hyaluronic acid, which is a naturally occurring substance in your skin. And it helps basically build that area and provide volume where your body's losing it with aging. Now, the only exception to that is lips. And that's right up there with the nasolabial folds as the top treatment area. Lips have become really popular. And in the younger generation, women in their, upper teens to 20s are getting lip fillers. So very safe, very effective. You just want to make sure that, you go to somebody that is able to identify any potential complications and be able to reverse those should they occur. The great thing about this, everything you do comes with a risk, but with the fillers, we do have a substance that can dissolve that hyaluronic acid if you were to inject into a blood vessel or if you compress a blood vessel. So it's good to know that you have that protocol in place and that your injector knows that.
Mm-hmm. Yeah, that's good to know. So the lip filler, so all of them, Juvederm, Voluma, all of those are all made from hyaluronic acid?
Yes, and we specifically use Allergan products, which is these guys, the Juvederm. We've got Volbella and Voluma and Velour. So they're a little bit different in terms of that you got Juvederm and Juvederm Plus. Basically, the difference is the size of the molecule. The Plus we use for somebody that maybe has some really deep nasolabial folds. The plain Juvederm are used oftentimes for lips. Volbella, Voluma, those are what's called a Vicross technology, and it's the shape of those molecules add a little bit more volume, and they last a little bit longer. Volbella is used in the lips and any of the lines that are up around the mouth. It can occur with just genetics, or you can see them with people who smoke. But it's a very nice, soft, silk-like material that is a great filler. If somebody wanted to just augment their lips and what their natural lip shape is and not really add a lot of volume, Volbella is a perfect choice for that. And then Voluma is great for the cheek areas and sometimes along the jaw to be able to add some volume in those areas. And some don't, they just want to have those pronounced. So we have some people in their late 20s, early 30s that say, I don't really have any cheekbones. Can you augment those? That's a great product for that. And it lasts 2 years. And they call it a liquid facelift because, it's an alternative to having surgery or having implants, and very effective.
That's awesome. I've seen some places where when your head, right here starts to kind of go in, is that one of those fillers too?
Yeah, absolutely. That's the temporal region, and filling those areas and just above the brow works amazing for reducing the signs of aging. And some will show that more than others. So again, that's the importance of doing an assessment of each individual and looking at what they think they need. And then I give them, you know, a little bit of my assessment and what I feel like would help improve the signs of aging.
Awesome.
And I do have a picture. Here's one of the nasolabial folds. I don't know if you guys can see this, kind of a little bit of a shine
Oh,
on it.
wow. Yeah, no, I can see it good.
That's where I would use Juvederm Ultra Plus because she's got some pretty, you know, these lines here.
Yeah.
Pretty deep lines. And then here's a little bit more of a subtle one.
Wow, that does make a big difference though, as far as her
Yes.
kind of aging appearance. And does that have any facial movement hindrances or anything?
Not at all. Not at all. Now, if somebody gets a large volume in their lips because they really want it, their smile may change just a little, where when they go to smile, it's because you're going to have more product in there. So, but I can tell you the people that are injected notice it, not so much anybody looking at them. Mm-hmm.
Yeah.
They notice it themselves.
I remember when I was in your chair, my smile looked a lot different, but it was also so swollen from everything. And now I honestly think mine's natural enough that people who don't know or something they may not notice right away, people who've known me for a long time can usually tell something's different, but I like that it is natural. We always talked about how people probably always want more eventually, or they want them a little bigger. I probably would have done like half a syringe more, maybe just a little bit. Could you do the Juvederm? So I got just regular Juvederm, right? And then if I did Juvederm, can you mix, like if I did Ultra next time, would that give, if I did a half a syringe, would that be the same as one syringe of regular, or is that not how it works?
Yeah, yes, definitely, because it's gonna plump it up a little bit more. So you certainly could, and I truly have that conversation with patients on that, because I try to give you the best cost savings. If somebody just wants a little in their lips and they're going to have leftover, and they want, you know, maybe to put a little here to fill in those lines, that's what we do. We use it. It gets a little tricky though, because sometimes I have clients that'll come in and they're like, I want this fixed, this and this, but I'm only gonna have one syringe. It doesn't work like that. So we develop a plan, and I really try to reinforce that, you know, this is a marathon. This is something that you want to have a lifelong commitment to, and it will pay off. My little 85-plus-year-old gal looks amazing. You would never guess her age. She looks so good. And I would like to take credit for all of that, but she actually had been doing it before I started injecting her. So
yeah, that's awesome. I know as far as the movement with the lips, it's so funny. We were just talking before we came on here about like my weight, and this is probably why I was eating peanut butter off a spoon last night. And that's one of the few times where I can notice a difference with my lips when I'm like trying to lick like through a spoon or like lick my lips. But it's so minor, and I always can, but it's funny.
Oh yeah, absolutely. And then there's some individuals that, you know, they don't really want to start with a filler. So we actually do some Botox injections just above the lip, and it's called a lip flip. And that will just relax that upper lip and give it just kind of a little bit enlarged appearance. And it's very, very nice aesthetically. You do have a little bit of decreased whistling ability, and maybe drinking out of a straw might be a little bit difficult for a few weeks, but very, very popular and increasingly popular over the last year.
Yeah, some of the girls in the salon have gotten that, and it does look really nice, definitely.
Yeah. And with these treatments, you know, as far as the dermal filler, we do use a topical numbing cream, and you can probably speak to that, Alana, as far as like the discomfort with it. It's not 100% pain-free, but I feel like it's very tolerable. I actually went to a training and had nothing on there, and I can tell you, the numbing cream, it works very well.
Oh yeah, no, I can't imagine doing it without. I'd read online somewhere that you should try and do it without, because then you don't have that extra swelling from the numbing or something like that. But I've gotten zits like right on my lip before, and that hurts so bad. I just couldn't imagine doing it without it. And while, like you said, a small amount of discomfort, it really was nothing unbearable at all. And you said the Juvederm had lidocaine in it, right? Yes. So as you were injecting, it was becoming more numb. So after those first couple, and there were some spots, I remember like the sides were a little bit more sensitive, and maybe like right in here, but definitely not bad at all. I mean, you can watch those videos and see that anyone who knows me knows I am pretty low pain tolerance. Like I will wriggle and whine if I'm uncomfortable, and I was sitting through that just fine. So that's a good tell. Yeah. So if someone was wanting to get lips or filler, a mother of the bride or the bride or something like that, how far in advance would somebody want to do a procedure like that?
That's a great question. So you have a potential for bruising more so with the dermal fillers than you do with Botox, but because you have a needle and it's piercing the skin, there's always a potential for bruising. And if you're somebody that you know you bruise, recommended, taking some arnica, which is like an herbal supplement that helps with bruising and actually prevents it. A lot of plastic surgeons will have patients take it before a surgery. However, if you're on blood thinners or if you have numerous medications, of course, I'd always want you to consult with your medical provider. So that's one thing we could do, but a good month ahead of time is ideal. Or 6 to 8 weeks, especially if you feel like you might want some touch-ups, because the bruising, the swelling takes a good week to dissolve. We do use laser. We have a laser that will treat some bruising if needed. I don't like to use it a lot because there's not really been a lot of studies that show what it actually does to the product when you use that laser. So that is an option. But it takes a good 4 weeks before that filler really integrates with the skin and surrounding tissue to know kind of what your outcome's going to be. And if you need touch-ups, it's always nice to have a little bit more time to do that. So, and Botox really a good couple weeks ahead of time, would be sufficient. But again, 4 weeks is even better. That way, if you need touch-ups, you'll have time to do it.
Yeah. And if you get any, like you said, bruising or anything.
Yes.
Awesome.
Yes.
Well, that was enlightening. So